with HSAs, obviously the thought is that as the patients control and direct their healthcare money, their
Hmm.
dollars, they're going to look for low cost alternatives that are high quality, whatever.
Yeah.
What is that just does that just not happen because you're within the confines of a lousy system and there's just no exit to get to a spot that you can save money?
There's a few reasons. The system said, here, we're going to give you more skin in the game and we want you to be a good consumer. But what do you need to be a good consumer? You need cost and quality. It's impossible to be a good consumer of anything if you don't have cost and quality. And those are the things that the system has been fighting to hide. Even when laws go into effect, they still fight to hide them and make it very difficult. So we have access to cost and quality around the country at almost every provider and facility. And that's why we say to employees, look, you can go wherever you want to go. Like I said, we don't have a network. So you can continue to go where you're going. And we're still going to save the employer a ton of money for two reasons. One is how we price the care. And the other is those PPO contracts typically have audit prohibition clauses in them. We don't have those contracts. And so, and just to give you a couple stories, there's a hospital down in Texas that was doing a pregnancy test on every admission, even if that patient were male, post hysterectomy, post menopause. It didn't matter because they were taking a 14-cent test and marking it up $1,400, and they knew the carriers couldn't look deep enough to find it. We had another hospital that was doing surgical implants in the spine. They were using surgical screws, and they billed for 12 screws, which caught a red flag for me because I know the national average for that type of screw is 7. So I asked for full clinical notes and I got the notes and it said they had only implanted 8. And when I called them and I said, why did you charge for 12 when you implanted 8? They said, well, it came in a pack of 12. We had to throw the other 4 away because they weren't sterile. And I said, they didn't come in a pack of 12. You ordered them in a pack of 12. The manufacturer lets you order them in any quantity you want, but you order them for way more than the national average. So you knew you could charge way more than the national average. Insurance companies are not only not motivated to find these things because, again, more claims going out the door is more money, but they're prohibited from asking for the information that would allow them. But let's say by some freak of nature, they find one of these things a year or two later. Listen to this craziness. If they're fully insured, if it was on a fully insured plan, the carrier gets to keep the full amount. If it's a self-funded plan, I encourage any self-funded employer to go read their administrative services agreement. It's going to say that if the TPA finds an overpayment, they're going to be able to keep 40% or 20% or 50% of what they find. So
Uh,
what's their incentive to even look when the less they look, the more money they make, and the more that goes out the door erroneously, the more potential money they make down the road?